A sharp increase in respiratory infections is forcing a lot of parents to decide whether to deal with their child's symptoms at home or should they head to an ER. Here with some advice on that is Dr. Kristen Moffat, infectious disease specialist at Boston Children's Hospital. Nice to see you, doctor.
Hey, Dr. Moffat. It's always great to see you. So we're getting a lot of questions from the viewers about RSV. So let's just set the table first. You have told us this before, but let me check the boxes. The virus itself is nothing new, right?
Correct.
In fact, the CDC estimates that it will infect nearly all children in the United States before their second birthday, right?
That's true.
So why does there seem to be so much concern right now?
The concern right now is really due to the very high number of children who are experiencing RSV infection at the same time. And that's occurring when there were already a number of respiratory viruses like COVID-19 and rhinovirus that were also infecting lots of children. So when you take all of that together with this RSV surge, it's putting significant strain on children's hospitals, children's emergency departments, and urgent care centers right now. And the concern really is that it's that strain on those resources that could make it difficult to be able to provide care for all the children who need it.
The state doesn't count, doctor, the number of RSV infections, but local hospitals are telling us they're treating dozens of children for RSV every day. So how do you decide, and this is how we started this whole conversation, who needs to be hospitalized? If you're a parent, how do you decide that? And then as a healthcare professional, how do you decide that?
Yeah, no, it's a great question. Parents should really, and this is true for any respiratory virus, but it also applies to RSV. Parents should be looking at their child's work of breathing, which means, does it look like their child is struggling to breathe? Are they using extra muscles in their neck or between their ribs or in their belly to breathe? Are they flaring their nostrils to breathe? So that work of breathing is really important to assess. Does it look like they're breathing a lot faster? Another big thing to assess is the child's hydration status. Especially very young infants can have a really hard time keeping hydrated when they've got a respiratory infection. And what would be evaluated in an emergency department or an urgent care setting would be to look at their oxygen levels. Are they maintaining appropriate oxygen levels, and are they well hydrated enough? And those really are the criteria for hospitalization. Children may need some respiratory support in the form of supplemental oxygen, and they may need some hydration help, maybe from IV fluids.
So let's take a look at the calendar. In a typical year, the number of RSV cases peaks sometime between a little around Christmas-ish into mid-February. So here we are at the end of October. How do you think this year could be different?
Yeah, it's really hard to say. You could imagine, though, that because we're seeing so many infections so early, we may see a taller but narrower peak of RSV infections this respiratory season than the more typical sort of steady plateau that we see spread out between really November and March even. And that's because since so many people are infected right now, we know that an RSV infection generates very good immunity from another repeat RSV infection, especially in the several months after having been infected. So it may be that we're making that peak much taller and earlier right now. And it's hard to say, but that's one possibility.
This is another question. As you know, it's almost Halloween. A lot of grandparents out there want to see their grandkids in their costumes. Before they get together, are there any special precautions that families should take?
Yeah, I think families should remember that older individuals are more susceptible to severe infection from RSV, as well as from COVID-19, influenza, and many of the respiratory viruses circulating right now. So it would be really important for families to really do their best to make sure everyone in their household is up to date on vaccinations against COVID-19 and influenza, for example. It also would be really important to make sure that if anyone in the household has symptoms of a respiratory illness, they should not be in contact with those older individuals. Families can take some extra steps, especially if there's a grandparent with an additional medical condition that makes them vulnerable to severe respiratory infection. And those extra steps could include home COVID-19 testing and could even include masking if families choose to do that.
Dr. Moffat, thank you for your time. It's great to see you.
Thank you, doctor. Stay well.
Take care.
To our viewers, if you have any health questions that you would like our experts to answer, email them to ask@wcvb.com.